welcome. How are you doing, Elena?
Hi, I'm good. Doing well. How about you?
I'm good. Thank you. Thank you for being on the podcast. Before we get started, I would just like to say that I am your host, Osheen, and this podcast is brought to you by Maps Canada. This podcast is for educational and informational purposes only and does not constitute medical, legal, or professional advice. I would also like to acknowledge that I'm recording this podcast from the traditional, ancestral, stolen, and unceded territory of the Hamasquam, Squamish, and Tsleil-Waututh people, and it is now called Vancouver. So I am very, very excited for this because I have with us Dr. Elena Koning, a neuroscientist, author, and knowledge translator working at the forefront of psychedelic science and mental health. Elena is a Killiam Postdoctoral Research Fellow in the Department of Psychiatry at Dalhousie University, where her research examines the clinical utility of psilocybin, a psychedelic compound in magic mushrooms, as a tool to enhance gold standard psychotherapy for eating disorders, one of the most complex and difficult conditions to treat. Beyond her academic work, Elena is deeply passionate about teaching and translating evidence based research into accessible creative formats. She's also the host of the Integration Session podcast, where she brings together psychedelic scientists and clinicians to explore what the data actually tells us and what it doesn't. It's super cool. In this conversation, we'll get into the science behind psychedelics and eating disorders, the promise and limitations of the research, and what responsible evidence based innovation can look like in this rapidly evolving field. Before anything, I guess I would just like to acknowledge and ask you that you are also a volunteer at Maps Canada and you are right now a guest at Maps Canada podcast. So you want to tell us like what you do at Maps Canada and what drew you to that work?
Yeah, for sure. So I started volunteering at MAPS Canada when I was in my PhD degree. So it was sort of around the same time that there was this emerging hype around psychedelics. It was like 2020, 2021, COVID. I was looking for things to do. And yeah, I think it's always great to have diverse opportunities and experiences in psychedelic research. I think that often research communities can get a bit siloed. So I really wanted to be involved in something a little bit different than what's going on in Ontario. So I know there's a lot of across Canada collaboration with MAPS. So yeah, I was excited to get involved in that and specifically contribute to the research committee. So I was brought on to help with the EXPAND study, which is basically a survey of prescribers' experiences and attitudes towards the special access program. So that study has been a long time coming and it's currently in the manuscript preparation phase. So hopefully it'll be published very soon.
Yeah, I love that study. I just love the whole concept of asking prescribers if they would prescribe psychedelics or not. Thank you so much for that answer. I guess talking about psychedelics and prescribing psychedelics, I would like to ask you, what do you think is like a misconception that still makes you cringe when you hear about that?
Yeah, so cringeworthy things that I've heard. I think a big one that we often see in the media and especially sensationalized content around psychedelics is that it's some kind of magic pill or that the substance itself is doing all the therapeutic heavy lifting. So there's often a lot of focus in the media, not discounting those experiences, but I think that there needs to be a little bit more room for nuance here. So the fact that things like set and setting also play a huge role, or that preparation and integration can be just as important as the dosing session. I think that's a common misconception. And I'm not really like only interested in how the psychedelic substance actually affects the brain. It's also how we can like decenter the psychedelic maybe and think more about the psychotherapy that's surrounding that experience and how the psychedelic can be a tool to have brain changes or psychological changes that really open up an opportunity for the psychotherapy that is evidence-based to be more effective. So, for example, creating a state of cognitive flexibility or improving mood, and that being a mechanism to improve the effects of evidence-based psychotherapies. So the substance sort of like opens the window, and the psychotherapy is what is actually making the durable changes.
I love that answer. And I hope for audience with misconceptions around this is like they help see that it's not like people make the medicine carry all the weight. And you said it so beautifully. Like, I feel like, with allopathic medicine, like the big pharma, we do sort of give responsibility to the medicine. Like, if you have pain, take an Advil and then it should go away, but it's very different with psychedelics. So, thank you for explaining that so beautifully.
Yeah.
Um, if you had, like, talking about the cringeworthy stuff, if you had to explain psychedelic assisted therapy to a skeptical family member in one sentence, what would you say? Or two sentences?
Hmm. I think that that's hard because, again, it's sort of like the problem of like nuance. So it would depend, I think, on a few things. So, first of all, who is this family member? Is it like my fun aunt who's like just curious about my research, or is it like an older relative who maybe has like preconceived like skepticism or biases in some way? I think everyone is different, but I would probably say something like psilocy- psilocybin or psychedelic treatments. These are a form of medicine that are derived from ancient practices and also Western modern medicine. Um, and it's a type of treatment in which a psychedelic substance, so like psilocybin or MDMA or LSD, is administered in a medically supervised context with psychological support during, before, as well, and after the psychedelic experience. And to add one more thing, that there is emerging evidence, peer reviewed evidence in reputable journals that this is a method that is helping people to reduce their mental health symptoms.
Mhm.
So that's probably what I would say, but I would also say that it's really great to be skeptical, even though there is like strong evidence. The field certainly has limitations and it's still emerging. So I always welcome skepticism and I think it makes a good scientist. So yeah.
Exactly. That's a sign of a good researcher, like skepticism. Talking about research papers and journal articles, like let's say this skeptical family member is not very like into reading academic research journals. So is there a book or like, I don't know, a TV show that you would ask them to watch about therapeutic healing of psychedelics?
A book or a paper? Or what did you sorry,
Or a show or like anything?
hmm, that would help them learn about psychedelics?
Like I usually tell people to watch How to Change Your Mind by Michael Pollan, the Netflix documentary, because people watch Netflix.
Yeah, yeah, definitely. I think that's a good one. I think with How to Change Your Mind, it is a good sort of like overview and like introduction to psychedelics. But again, I think it can lead to a bit of like sensationalism or like, Hollywood like aspect. So I think that I would say, yeah, I would recommend, whatever suits your interest. If it's a book that you find interesting or a show, definitely lean into that, but also ask questions and consult experts and look at diverse experiences as well.
Yeah, thank you
Yeah.
so much. What do you think if you were not in the psychedelic science field, what would you be doing instead?
Interesting. I've always really loved animals growing up, and I was always really fascinated with them. I mean, I could spend hours, like, playing with frogs and fish, and we always had dogs growing up, and I had a horse at one point too. And my first job was actually at a vet clinic, and one of my early dreams was to be a veterinarian, but I think that animal healthcare is very different from human healthcare,
Mm,
and I didn't really realize how difficult it would be to witness sort of those differences. So this is like becoming a long answer,
mm,
but I think if I wasn't in psychedelic science, I would be in some kind of a field that contributes to animal welfare or wildlife conservation. Here in Nova Scotia, we have a really amazing center called Hope for Wildlife, and basically a wildlife rehabilitation center that I visited recently, and I really love what they're doing there. So I would love to work at something like that. I just think that, yeah, nature's so precious and important to stand up for beings that can't really stand up for themselves.
Oh, I love that answer. Thank you so I have a dog myself and I have
Yeah, me too.
rescued birds in India. So like that answer really resonates with
Wow,
me.
nice.
um, thank you so much for that beautiful, beautiful personal answer. I would ask you some research-based questions now. So as I introduced you and told everybody that you're doing research in eating disorders, so what do you think? What makes psychedelic assisted therapy conceptually different from the traditional symptom reduction approaches that we've been using in eating disorder?
Yeah,
Um,
so traditionally, an eating disorder treatment usually involves psychotherapy. There aren't many medications or pharmacotherapies that are used for eating disorders. And the gold standard usually is cognitive behavioral therapy. So that's a type of therapy that's designed to alter the cognitive and behavioral processes that sustain the eating disorder symptoms. So that can look like cognitive distortions about body shape or weight or things contributing to dietary restraint. And the CBT or cognitive behavioral therapy is just a series of therapy sessions, talk
mhm,
therapy with a therapist that's specialized in this area to overcome those thought patterns, which can be very rigid and very inflexible in these patients. So psychedelic treatments are different in terms of their like structure and logistics, which I'm sure your listeners are a bit aware of. In theory, it could help to elicit better outcomes from CBT, for example,
mhm,
cognitive flexibility or allowing patients to more easily overcome these rigid thought patterns. So, this could be helpful for eating disorders because these rigid cognitions and beliefs about their body weight and shape can be a main reason why they have poor outcomes or drop out from CBT, which is
mhm,
a huge problem because dropout rates are around like or up to 50%, which is very
oh,
substantial. And even individuals that complete CBT only have like a 40 or 50% chance of sustained recovery afterwards. So, this is a really big problem in eating disorder care. And I think the differences between psychedelics and CBT can sort of be like a strength that can help enhance CBT.
wow. Okay. Yeah, I have read a little bit about eating disorders research, and what you're saying is so true. Like the dropout rates are really high. Psychotherapy, like it doesn't reach everybody the way it should. Um, are you specializing in one of the eating disorders, or is that like the general theme?
Yeah, so I'm interested in psychedelic treatments for eating disorders in general. The majority of the evidence right now is in anorexia nervosa, which is I find it is important to distinguish the different eating disorders because they are different in their neurobiology and their phenomenology and in their clinical correlates. So, for example, someone with anorexia nervosa might need help with overcoming cognitive inflexibility and dietary restraint versus someone with binge eating disorder might need help overcoming their binge eating compulsions,
Mhm.
developing healthy dietary habits. So I'm not specialized in a particular eating disorder. I'm interested in how psychedelic treatment could be used broadly in to enhance eating disorder therapy.
I see. I see. What do you think is like a unique challenge when it comes to psychedelic assisted psychotherapy for eating disorders?
Yeah, so I think there's a few. First of all, there isn't a lot of existing evidence in eating disorders, so there are
Oh.
very few studies, and the ones that we do have are small, open label, and mostly in anorexia. Um, in terms of other challenges, I think what comes to mind is the unique psychological and medical vulnerabilities that people with eating disorders have. So, this isn't well studied, and there definitely needs to be more work in this. But for example, gastric emptying is altered in people with eating disorders, and that can
Mm.
affect how the psychedelic substance is metabolized. So, I don't think there's empirical evidence for this yet, but just informally, I've heard from psychedelic therapists that eating disorder patients need higher doses of psychedelics in order to achieve the same intensity of the subjective effects. And individuals with eating disorders also often have cardiovascular abnormalities. So things like bradycardia or low heart rate, hypotension, cardiac arrhythmias, and electrolyte abnormalities. So these are all things that could be affected by psychedelics in some way or could theoretically contribute to some adverse events. But that being said, existing studies don't really point to any serious adverse events. So in the main study that happened with psilocybin in anorexia nervosa, there were no significant adverse events, no significant changes in the vital signs, and the intervention was deemed safe and tolerable. But more research is obviously needed to really confirm the safety. And just one more thing I want to mention is the psychological challenges in eating disorders, which is not really addressed in current psychedelic therapy models. So things like nausea and vomiting, which are common with psychedelics, these could be triggers or could be destabilizing for people with eating disorders, especially if they have symptoms of self-induced vomiting or purging. And another psychological distressor could be changes in embodiment or body image distortions during psychedelic experiences, since a lot of individuals with eating disorders do have a preoccupation with how their body appears to them and their shape and size. So these are all things that we don't really know, like what is the best protocol to address these things, and just the potential long-term effects that this could have.
Yeah.
We just don't have enough research and thought into eating disorder specific psychedelic therapy
Mm.
protocols, which is something that our lab is working on.
I'm so glad that this is being looked into, and yeah, this is really interesting. What would you say, like, how do we responsibly communicate early findings without overpromising to the vulnerable population, like people with eating disorders or other vulnerable populations, about this early stage findings?
Yeah, so I think we've definitely learned throughout the early days of the psychedelic renaissance and even around the COVID-19 pandemic that science communication is very critical for public health and for informed decision making. And like you said, it's really important to be transparent. So I think that's the main thing is being clear about the level of evidence that we do have and really managing expectations about that level of uncertainty and actively engaging with the community through the communication process. So, knowing your audience, knowing how to communicate with them accordingly, to really make sure that findings aren't becoming over sensationalized in the media or sort of like over promising on the therapeutic effects of psychedelics. I think it's about putting the findings into the right context. So, we're not doing that. And I'm not saying this is easy, and it certainly doesn't, like, help to, like, social media the goals of social media is to capitalize on your attention essentially.
Yeah.
So things that are the most like attention grabbing or the most like striking or salient, and that doesn't really run with academics and scientists that are trying to, really temper what they're saying and, oh, we think this may have this effect potentially in this specific, like that doesn't really sell, like that doesn't really get clicks. So I think there is a bit of a divergence there that we need to sort of like find somewhere in the middle, and just making sure that we're prioritizing science and evidence and individual public health over any kind of other ulterior motives.
Hey, we hope you're enjoying the podcast so far. Now, if you want to support and become part of the psychedelic movement, feel free to donate to MAPS Canada at the link in the description below. Thank you for helping our mission to support equitable access to legal and regulated psychedelic medicines for all Canadians.
Talking about ulterior motives, what ethical red flags do you see emerging as psychedelics are moving closer to the clinical legitimacy?
Yeah, so I think like any emerging therapeutic field, there are going to be a lot of ethical considerations, and that's certainly the case with psychedelics. One of the unique things that comes to mind with psychedelics is informed consent.
Mhm.
So we know that psychedelics lead to these really profound changes in how someone perceives the world and their psychological state, and they're really vulnerable to changes in their fundamental beliefs or values or even their sense of their self. And it's really difficult to sort of like convey that to an individual before they undergo the experience. So, how do you actually get informed consent then, if that's the case? And also to maintain that informed consent during the session when an individual's decision making capacity is altered. They might not be
Okay.
able to fully withdraw their consent, and they are impaired during the experience. And I think another thing there is, what was I gonna say? After the experience, I think also an individual, if they've undergone psychedelic therapy and they have this sort of positive effect on their symptoms or on their well-being, the clinical trial is sort of like done, and then in reality this is still a controlled substance that we don't really have a lot of pathways to access. Like, there is the special access program or individual section 56 exemptions, but if an individual has really really striking benefits, then the trial's over. And where what if they are like, oh, that's the first time I felt better in a long time, but I can't actually access this treatment even though I know now that it works for me. So that's a huge thing I think we'll have to really address and take a look at, is making sure that we're allowing compassionate access to psychedelics for the appropriate individuals, and that we're not sort of like gatekeeping these treatments. And that comes into broader ethical issues like equity and how will we actually broaden the access to psychedelics without over commercializing them or over um, limiting the individuals that can access them. So there's a lot of issues here. And of course, another ethical issue that you have to think about is cultural appropriation and making sure that we are really respecting that these are indigenous practices and that we need to recognize that and involve people, the original stewards of these therapies, and really make sure that there's an equitable sort of exchange of benefits in that way. And I'm not an expert on how that's gonna look, but I think that we need to just be open to that and thinking about that and consulting, uh, those original stewards of this work throughout the process.
Absolutely. I love like every little thing that you brought in into answering this question. I think everything is so important, especially about the harm reduction part, like about the taking consent and then thinking of harm reduction like post a psychedelic journey, because it can change you, right? As you said, like how do we even explain that to people that it may change you in such a way where people like donate their money and stuff sometimes after? And what if it's like, what if they're not completely lucid, and informed consent is valid then or not? So I think these are really, really important questions. And I did a podcast on harm reduction, and the clinicians who were doing that were actually talking about the post journey, the post integration, like after what happens. And a lot of the times, there's a lot of like financial repercussions, like, people who do especially underground psychedelic work. Um, if they don't have a good intent, like they will ask for more money, or they will ask like, there is another retreat, or buy this pack for 30-day like care or something like that. And people do spend because they've had just the most profound experience of their life. So
Mhm.
why wouldn't they trust that?
Wow.
And so, yeah, I think the consent should be really, really like descriptive and should include all of these things in detail. And also, it's a clinician's responsibility to explain it to the participant as well.
Mhm. Yeah,
So,
definitely.
yeah. What do you think like media and content creators like us talk about psychedelic differently than peer-reviewed journals do?
That's interesting. I never considered myself to be a content creator, but that's kind of true. I do create content, I guess. Yeah, I mean, I think that like peer reviewed journals are definitely boring, but I mean that's okay. Like, the audience is scientists and academics, and we can be boring sometimes. But I think that like I said earlier, there needs to be kind of like a balance here. Media
Hmm.
and content creators should translate these scientific findings and not necessarily like extend or amplify them or change them. Like, it should be like translating from English to French or French to English, not like translating and changing the words around. So it's actually a completely different sentence in French. And I think conflicts of interest are really important to delineate
Hmm.
here. So asking yourself, like, is this content creator making money off of this content in some way? Do they have some kind of like product that they're trying to sell you and they're telling you something that's trying to convince you to buy it? I would always be skeptical about someone who is promising something to you, but they're also benefiting from it in some way. And if something's too good to be true, then often it is. So I think just keeping that in mind as you're consuming content is really important.
Yeah. Yeah. And I think the type of content we create, like we are not selling anything. We are trying to make it as you said, like translating English to French, it should be as equivalent as it should be. And I think we are trying to do that here.
Yeah, definitely.
Yeah. Uh, what responsibilities do scientists have when their work intersects hope and desperation and identity?
Yeah. Those are big things that to sort of like be responsible for that, I think is not something to take lightly. I think that scientists definitely have a responsibility to stay evidence-based and uphold their ethical standards. So this can look like managing hopes and expectations, like I said earlier, so avoiding any kind of like hype or sensationalization, making sure you're communicating the limitations of the work that you're talking about. And this can be challenging because um, the media, like attention that psychedelics get, and these patients often are desperate for something to make them feel better. So it can be hard to kind of like balance that. Like, okay, we know that this is really needed, something that can make symptoms improve for mental health, but yes, this is very exciting that psychedelics is showing this in some people, but that's not like a promise that in everyone that will be the case or in every situation it'll be helpful. Um, so yeah, just making sure that our ethical safeguards are in place to protect the patients and just recognizing those inherent power dynamics as well and the vulnerable state that participants often are in. These patients, for example, with treatment-resistant depression, they might have tried, like, several different medications, nothing is working for them. This is, like, a, like, final effort to last resort to, have some improvement, so that is not something to take, like, lightly as the, clinician or researcher on the other side of that.
Yeah, that's really important.
Yeah, and also just
Uh,
maintaining, like, scientific and personal integrity, like, just being honest, like, in publications and in the dissemination process, according to the evidence and not necessarily, like, personal views or experiences. I think that is really important just to maintain honesty.
yeah, whenever I see like a journal article which seems a little clickbaity or like a YouTube video which seems a little clickbaity, like my like table where I'm like, maybe I don't trust this. Because I'm like, how are you so confident about this one topic about psychedelics? Like, do
Yeah,
we have enough research? This is
yeah.
definitely a clickbait.
I know, like, I find that as I learn more, I'm, like, m more what's the term? It's like the more you know, the less you think you know or something,
Yeah.
like, "Wait, I don't
Yeah.
know anything about how these substances work." Yeah.
Yeah. I want to also ask you some questions about the integration session, your YouTube channel, your podcast. So, how do you personally integrate research findings into your own worldview or your daily life?
Yeah, so I mean, when I'm reading a paper or a research study, I definitely reflect on what that means in terms of my own mental health. So, in the eating disorder field, that could be like how I'm viewing my body or my relationships with others or relationships with nature. And I think that psychedelic experiences, it's such a profound way to reflect on what's going on in your mind or to foster mindfulness.
Mm.
And like to create sort of like tiny versions of that integration in my daily life. So that could involve like just having a regular yoga practice or just being mindful about what I'm consuming, both in terms of my nutrition, but also the content that I'm allowing myself to consume. And just taking the time to be without external stimulation and recognizing, the thoughts that are coming into your mind while you're driving or walking or just sitting
Mhm.
at home. Um, so I try and just integrate those sort of insights into my life in any way that's sort of small. And just to foster like self-compassion and self-love. I think that's been the biggest thing from the eating disorder world is we can be really hard on ourselves sometimes, and you really just have to take a compassionate approach with yourself. And we're all doing our best, and it's just important to show love for not only those around you, but also yourself, I think.
Yeah, absolutely. I love that. I want to give myself a hug because my body does so much for me.
Wow, yes,
We are
incredible.
so hard on ourselves, and we are especially like I think people who identify as women like are made to see a different, like, a certain body type and a certain skin color and a certain hair tone and all of those different things, and that's what make a perfect woman. So yeah, it's hard out there, and no matter how much you like not want to see the social media or not want to see the television, it gets you. So
Yeah,
yeah, I
yeah, and
appreciate that
having
answer.
self like, compassion for that, like, if you find yourself, getting frustrated with any of those things, it's, like, not to be hard on yourself for that as well.
Yeah,
Like, we do live in this world that does, prioritize certain things or that rewards certain things, and if you're responding to it in some way, that is not your fault. That's just a product of the society that we live in. It's just doing what you can to foster positive perspectives and self love, I think.
exactly. It's kind of a oppressive society that we live in, and then we take it out on ourselves. So yeah. Moving on, I would like to ask you, how can people integrate insights without psychedelics, like using science-informed practices? And what do you think that is, like integrating insights?
Yeah, so integration, it's a really important part of the psychedelic therapy process, and definitely has meaning beyond that as well. Like I said earlier, of just the little things you can do in your everyday life. It is an ongoing process, of just deliberately working with and incorporating insights and new perspectives, gained during not only psychedelic experiences, but anything that's happening in your life. So just being aware, first of all, of that, and then putting in the work to make those positive changes, kind of like a bridge between like what you're experiencing and how you are translating that into something that's sustained as a long-term benefit for you. This could be anything from just like reflection on your life, journaling, creative expression, mindfulness, or community support, connecting with nature. So it's just ultimately about turning the potential for well-being and healing into actual lasting healing. And yeah, everyone can do it outside of you don't need a psychedelic to do that.
Yeah. Like, I feel like we should be integrating everything. Like, if we go to a classroom and we come out of it, we should integrate the insight of what we learned there. Or if we have a beautiful conversation with a friend or what we eat, like, it can be part of our lives if we just take time to think about it and integrate it into our lives.
Yeah, definitely.
Um, yeah. So, like, integration is sort of, again, like this term in the psychedelic field is kind of thrown around and everybody's talking about integration. For me, integration is like the most important thing. And without integration, I feel like there is no healing. But it's kind of oversimplified and often misunderstood. And I know you like really explained it beautifully. But what would you think, like, why is integration misunderstood? Like, people just think that they can take psychedelics and they're like, okay, like, why do they need integration? What would you say to that?
Yeah, I think part of that is just that the dosing session is the more exciting aspect, I think. Like, that's where the profound things happen, and that's where people say that's the one of the top 5 most meaningful experiences of their lives, um, in some studies. So I think that there's a large focus there, and then people don't really it's not, like, as flashy or as, like, appealing to focus on the actual sustained work that you actually need to do in your daily life to have those long-term benefits. So I think that's part of it. And um, but there's also just like the aesthetic aspect of integration. So like you think of like journaling and like your crystals or your like whatever helps you like integrate. But it's more than just those like aesthetics. It is just like the boring, like everyday, like doing the hard thing, whether that's like apologizing to someone or like just setting boundaries or, you know, whatever that like mundane thing is that's going to help you improve your well-being.
Yeah, like just that apologizing to someone or setting boundaries can bring you so much peace.
Mhm.
um, so I'm realizing that we are almost like time is getting over. So
Crazy.
I would
This
like to
is
ask you
flying
a few.
by.
I know, like I was like, what? I would like to ask you a few more questions, but we'll see how this goes. So, what's one uncomfortable truth the field needs to face sooner than or later? And you are in the field, like you are researching. So,
Mhm.
what do you think?
Yeah, I think a really uncomfortable truth that I find difficult sometimes is that not everyone is going to be helped by psychedelics, and some people are genuinely going to be harmed by psychedelics. And we don't really
Mm,
have reliable ways to predict who is going to fall into which group. So we need to make sure we're discussing these treatments as not cure-alls and like magic pills. And these are
mhm,
things that we need to study and research and have evidence-informed protocols to ensure safety and also their therapeutic effects. And also on the other side of that, making sure that we're not excluding groups that could benefit from these treatments. So I think really getting real about who this is for and how we should be going about it, I think is something that I think about a lot. And it definitely, everyone wants a magic pill. Like, as someone who
uh,
wants to see suffering be alleviated in people with mental health issues, that would be amazing. But I think we just need to get real that that is not the case here.
Yeah. Wow. I absolutely love that answer. And I feel like a lot of researchers shy away from saying this out loud.
Mhm.
But even here at Maps Canada, we released an episode called The Cautionary Tales. I will link it here. And that speaks about how a clinical trial failed this person like many, many times over and over again. And this person has HPPD and, PTSD from all of this trauma now, which is like the psychedelic uh, taking off medicine trauma. So, yeah, I hear you loud and clear that that is a really uncomfortable truth, but it is the truth. So, thank you
Mhm.
so much for acknowledging that.
Mhm.
So, before the episode ends, I would just like to ask you, what do you want listeners to reflect on after this episode ends? Or what do you want listeners to integrate after this episode ends?
I think just that's hard to like boil it down to one thing. I always say, like, just, like, coming from a place of, like, love and compassion for yourself and others is always a great takeaway that I think we need more of in this world. But a more
Mhm.
practical one in terms of, like, psychedelic science and sensationalism and things that we've been talking about, I think is just asking yourself and trusting yourself in terms of, um, being skeptical about what you're seeing and asking those questions like, you know, who is this person? What are their credentials? Are they trying to sell me something? Is there any kind of financial stake here? I think in the age of there's like a lot of fear mongering about uh, we're losing critical thinking because of artificial intelligence. And I don't know if that's true. I don't know if there's evidence for that, but I think that just trusting yourself and being skeptical and critical and not trusting everything you see is an important thing for sure.
Spoken like a researcher. I love that answer. Thank you so much. I think beautifully said, and this is the perfect place for us to end. And thank you so much again for coming to Maps Canada podcast. We are honored to have you.
Oh, thank you so much for having me. This was a great discussion. Thanks.
I loved it too. All right. Have a wonderful day. Take care.
You too. Bye.